I'm Alexis Jacquier.
Hello, I'm Vincent Vidal.
Welcome in Timone Hospital.
We are very proud to show you the first installations of Allia worldwide. So, which is really interesting in this new setting is the ergonomy for the physicians.
With that new Allia angio suites, the ergonomy of the room is really increased.
Here you have a touch panel. With that you can command all the room, all the devices. And here you have command to your fingertips. That means that you can choose the angulations of the tubes. You can move the table, and this is very, very useful when you are not here. When you are at the head of the patients, like for CHIPS procedures, for example. I think there is a very good compromise between the quality of the image and the dose exposition.
The new Allia system allows to be focused on the intervention, knowing the dose is automatically handled by the system.
You have a dose limiter. During the procedure, you see very well which is the target for dose that you don't have to go over.
The CBCT acquisition is really interesting, and we use it daily.
There is a wide bore, so you don't have to move the arm of the patient. When you want to do a CBCT, you just have one click and you do the CBCT.
I was impressed by the numerical zoom. The quality of that zoom increased tremendously, and we can work with the images, CT scan images acquired before. We can work on the 3D acquisition, we can work on a fusion acquisition really easily with that new room and new settings.
So of course today for a lot of procedures, and especially for percutaneous procedures, for guidance, it's very important to have the fusions with CT, with ultrasound, also with MRI, and of course here you have plenty opportunity to do the fusion, especially with ultrasound, which will be very helpful and will secure the targeting of the lesion.